independent study shows most Massachusetts nurses believe patient care is getting worse here. 22 News State House reporter Tiffany Chan explains how it's costing you both your health and your money.
The report, paid for by the Nurses Union, surveyed 200 union and non-union registered nurses throughout the state, and what they discovered may have you questioning your hospital's quality of care. Healthcare has taken a huge hit in Western Massachusetts. To add to growing concerns, an independent study conducted just last month shows nearly 80% of registered nurses believe hospital care is getting worse, and they say it's because of high patient loads.
Sometimes I do have to drive home through tears in my eyes because I feel like I wasn't able to do everything that I could.
But how credible is this study? After all, it was paid for by the Nurses Union, which is pushing a ballot question on patient limits. The Massachusetts Hospital Association says it's not credible at all. There have been no federal or state level concerns on patient loads and no evidence that supports the union's claims. So if nurses are struggling, hiring more nurses seems like the solution, right? Well, a large chunk of a hospital's budget goes towards paying staff, and it can get very expensive.
We've got to find that balance between funding and having the right safety and the right number of nurses to address the issues that we really have in places like Holyoke and throughout the Commonwealth.
High patient loads could also cost you more money. A report by the state shows that Massachusetts ranks 42nd in the nation when it comes to avoidable hospital readmission. The report also shows that these preventable readmissions are wasting $700 million of your taxpayer dollars every year. Live at the State House in Boston, Tiffany Chan, 22 News.